Hello, hello, ladies. Please let me know if you can hear me and if you can see me. I don't have feedback from nobody yet. Please let me know if you can hear me and if you can see me so I would know that we can start soon. Melanie, can you hear me?
Yes, sorry, I've just got a coughing fit. Sorry.
That's quite, that's quite all right. Mary, can you hear me? Most importantly, hear me and see me too, if it's possible. I need you to see me too.
I can see you and hear you.
That's beautiful. Ladies, so we probably gonna have more participants joining as we're gonna go through the Zoom. We changed the Zooms. Our usual Zooms used to be at 11, now they're at 10, in hopes that Australia, it will be easier for Australia to join. It's still 2 a.m. in Australia though, and I know that my Australian girls are the last one to join. Okay. Staria, can you hear me? Can you see me?
Yes, I can.
Amazing. So I was saying that probably more people will join. I will be with one eye looking on the site. And I think we should already start our Zoom. This is our first Zoom, our orientation Zoom. Very nice to meet you, everybody who I don't know. Yeah, let's start right now. And as people will join, I'm just gonna accept them into the Zoom. So my name is Helena. My name is HelenaPahava. I am a practicing esthetician for 32 years now. And I'm also third generation esthetician. So I was born, raised, and now growing older in this industry and in this profession. So you probably all know a little bit about me from the Instagram. Usually that's how it works. And I will be clearly your trainer for next 1 month. In the next 1 month, we are going to spend together. So in this course, of course, clearly we learn hard skills like how to do massage, how to do this particular massage correctly, what is the sequence. But we also learned soft skills, how to connect to the client, how to make sure the client comes back to you after you gave the great service to her, how to maintain clients' results. So all that is going to be addressed in this course. We're going to spend together, as I told you, 1 month. Over this 1 month, I will be completely available for you. You are my top priority. Usually, I ask 24 hours to reply a question. It never takes so long, but I like to secure myself and give myself just a little bit more time, just in case. Usually, as soon as I see that there is a question or there is a video, I jump on it right away. As I told you, you are my priority. The way this course works. Yesterday, all of you, and if you didn't, you will tell me, have received the whole packet of the course. This is the facial. This is every step and how you have to make it. And each step is addressed differently, and then we combine them. This packet is never going to close for you. It's yours to keep. Not only it's never going to close for you, I consistently readdress what we're doing and how we do it, because at this point I use my treatment room as a research lab. I see what moves work better, what approach works better, not only for your client, but also for your own body. And then if I find something better that works better, I just change the video in existing course. So you bought course, whenever you bought course, you started it today. Year from now on, you will still gonna have this course, but it's probably gonna be revised. So I consistently make it better, consistently, and every once a year, sometimes every 3 years, it takes. But as soon as I see something that I can improve, it's improved, but it's improved within your course. So you still have it, it's yours. The second thing we do, we have 5 Zooms altogether. Today is our first Zoom, it's our orientation Zoom. Then we are going to have facial exercises soon, because they're extremely important in this particular method. We need to keep clients' results between the facials, and this is how we do it, by coaching them to do correct facial exercises, right? The third Zoom is going to be concentration training, because without concentration, it's impossible to do top quality facial. In top quality facial, you have to be zoomed into your client. It's not easy, it's quite difficult, but you're gonna learn how to do it. Next Zoom after that gonna be skincare Zoom, because even if you're LMT, and I have a lot of LMTs, you work through skin. You need to understand what you work with, how it's going to react, what is it made of, what's good for it. So we're definitely gonna have Zoom for skincare. I find it very important. And the fifth Zoom is Zoom for social media. Social media is a driving engine of your business nowadays. I used to work in New York 80s, 90s. It was very different. But honestly, you know what was driving engine of our business? Magazines, Vogue magazine, Allure magazine, in that time, InStyle magazine. That was our exposure. But it was difficult to get there. However, now it's much easier. We can be our own editors in chiefs. We just have to use social media correctly. And this is going to be our last Zoom. Because for successful business, for successful estheticians, you need two parts. One, impeccable skill, the skill that can really deliver result. Two, exposure. Because no matter what a great esthetician you are, if nobody knows about you, or if more and more people don't know about you, business that doesn't grow dies out. It never stays the same. You always have to grow. Your skills have to grow. Your business has to grow. Amount of people that want to come to you needs to grow. Otherwise, it's going to decline. And in our business, unfortunately, if business is not growing and doesn't become even more prosperous, it becomes very expensive hobby. And it becomes difficult and it becomes burden to fill out the book. So in this course, we cover all those layers of your skill and of your business. Why? Because the better you do in your business, the most comfortable you are with your finances, the most comfortable you are with the fact that your book is full, the most comfortable you are with your skill, the better result you're going to deliver to your clients. The less comfortable you are with yourself, with your skill, with your entity in our industry, the less proper facial you're going to deliver to a client, because your mind is going to be busy worrying about your own things. And we need your mind to be on the client. Sometimes I will be looking down to my phone also, just in case somebody tries to get into the Zoom. So forgive me, it's not very elegant behavior, but I need to get people to the Zoom if they're trying to join. So we're gonna have 5 Zooms. And then right after this Zoom, I'll ask you to send me your phone numbers and I will put you in a WhatsApp group. What do we need WhatsApp group for? Because the way you learn this material, we learn week by week. You receive the whole 4 weeks. But the way we're gonna approach it, we're gonna approach it week by week. Why? Because if you're gonna look through the whole material that I sent you, it's gonna look very easy. You'll be like, oh, it's so easy to do. It looks easy. In reality, it's not easy. It needs skill to perform it. So it would look easy and actually deliver result to the client face, because this is number one goal, number one priority. So for that, I don't want to mix everything. That's why we have 4 weeks. We're going to be really learning week by week by week. Don't rush ahead. Now, we're going to look through the first week today together in the Zoom, because I will prepare you and I will tell you everything you need to know about the first week. And then we form in Zoom. In a Zoom, I will ask you to send me a little videos of your work, of each move. Why do I need it? I need to see how you work. And yes, through the video, I will be able to tell you where you're making mistakes. The videos on WhatsApp, because we're going to make WhatsApp group, allow only 6 minutes. Remember that. So don't tape everything at once, because it's not going to allow you. The best way to do it is to do one move, send it to me, second move, send it to me, like this, move by move. Now, some people find it uncomfortable to be in a Zoom group. If you are that person, yes, you can send, you don't have to join the group, just write to me and I will look after your work separately. And I have a lot of people like that. However, I have to tell you, you are robbing yourself, if you choose to do it, from the experience to publicly showcase your work. And in today's day and age, if you're not publicly showcasing your work, you will not be able to compete in today's extremely competitive time. Everybody is on Instagram, everybody is on Facebook, wherever they are, showcasing their work. This is how clients come to you nowadays, by seeing your work, by seeing your results. One of my big goals in this particular course is for you to be comfortable recording yourself and showcasing your work. So if you're going to start from the Zoom group where you're showcasing your work to very friendly environment, it's going to be the best way to do it. By the time you have to showcase your work to the big audience, you'll be ready to do it. After I've seen all your work, let's say you showed me everything, that every move, and I have corrected you, and then you have to come back to me and show me corrected version. Or correction could be very simple and you don't even have to re-record it for me. I will tell you, you know what, if you're gonna stand this way, it will be better. You don't have to record it for me. Just you have to take it as a note. However, sometimes I will tell you, could you please re-record it for me? And then I will expect you to re-record it for me. So if something needs real fixing, then we will have to re-record it and record it until we have it done properly, right? After I've seen everything you have done, please pay attention to that. Then I will certify you. I will not be able to certify you until I've seen every move you have done, even though you bought the course. Let's say you joined even WhatsApp, but you weren't active. I haven't seen your work. Unfortunately, I will not be able to certify you because after my certification, I'm taking your work and I'm showcasing your work to my audience. At the moment, we have 167,000 people on Instagram. By the time you're going to be done with this course, we're going to be hitting 300,000 on Instagram. All those people are looking for HelenaPahavaMethod practitioner in the area. All those followers are real followers, and I have followers from around the world. So when I take your video and I put that video in front of my audience, I put my signature there that I am responsible for your results. I'm taking part of the responsibility of your results and your work upon myself. Because if they came to you from my Instagram, and a lot of them will, they will come back to me and say that they didn't like something, it wasn't done correctly, they didn't feel comfortable. So that's why I need to see exactly how you work before I will be able to showcase you to the people, because of the responsibility that I take upon myself. A lot of people going through the course, even if they join WhatsApp group and still don't want to showcase, it's a fear. So over years, I had hundreds of students. And if you're going to go to my Instagram, I will encourage you to go in story highlights, and you will see all the students that were ready to showcase themselves. And they're probably 50, 70 maximum. So a lot of people take the course, but then don't want to showcase. And that's why I added to this course soft skill, because I understood that just teaching you facial is simply not good enough. As I told you, so you will be a person who knows how to do excellent facial. But if you cannot practice it, if you cannot bring it to the world, if you cannot bring it to your community, then it's expensive hobby. And you cannot do it on yourself. You kind of can, but it's not the same. So for you to be able to use the skill, you have to practice the skill. For you to practice the skill, people should know about you. For people to know about you, we have to showcase you. And then they have to like it, right? It's very important. So that's why we have all those soft skills. So hard skill is how to do facial, and soft skill, everything that attached to it to make the big, lucrative, whatever you want, business out of it. Because the better, the most comfortable you feel within your business, the better facial you're going to deliver to your client. When clients start to compete for you versus you competing for the clients, because there is lots of estheticians out there, always more clients than estheticians though. But when you're not worried about booking and you have a waiting list and you price yourself the way it's comfortable for you, take as many clients as comfortable for you, work as many days comfortable for you, you simply deliver better quality facial. So it's like an airplane. Put the mask on yourself first. You have to make yourself comfortable to be able to deliver excellent facial for your clients. And this is how it works. So that's why I encourage you, please join the group. I will still review your work, WhatsApp group. I will still review your work if you didn't, and I will understand. I'm gonna have no question and I'm gonna have no judgment. But think how you wanna take information in this course. And the best way to do it is to join the group. When you send me videos in a group or separately, I will ask you to do one thing. This is very important for me. Make a video, send it to me, and underneath, write your own critique. Why? Because I'm not going to be with you all the time. Yes, I'm with you right now, but I'm not going to be with you all the time. I need you to know that you can assess your work and assess your mistakes. Until today, I'm 32 years that I'm doing this particular facial. I record myself occasionally to catch my mistakes. And not only mistakes that I do, so I have two cameras. One goes on top of client's face, and the other camera stays from the side of me. And the reason it stays from the side of me, because I need to catch my posture while I work. The amount of damage that we can do to ourselves by working in incorrect posture, it's colossal. We can really ruin our backs. We can ruin our wrists. We can ruin our fingers. We can ruin our shoulders, our posture. We can dismantle our neck and face. So that's why I put two cameras, because I need to see how I work on the client's face, and I need to see how I treat myself while I work, and understand where I go like this, where I lock myself, in what point I lost connection. So this is a very interesting research into yourself. It's very important to watch yourself work. You don't have to watch yourself the whole hour. 15 minutes is good enough to know where you're tensing, how you're sitting, and so on and so forth. And we definitely we are going to address it, because your posture while you work, it's the big part of your health. And a lot of estheticians, if you see like later in life, they have horrible posture. They usually are very locked. They have double chins because platisma is always like that. The wrists are hurting, the fingers are hurting, the lower back is hurting. Why? Because she didn't take care of herself, right? So when you go into the course, you will see exactly how to adjust your table. Remember, like you've probably seen it, you have to put the fist and put it to the table that you work, and while you're standing, and fist has to comfortably lie on table. This is the correct height of the table of where the client is for you. Also, I highly encourage you, I'm talking about in the course curriculum, you see, to get yourself settled back chair. Settled back chair will save your back. If you're going to go on Amazon or any place where you purchase your stuff, just put settled back chair, it's going to pop up. Just make sure it doesn't have back, but usually even the ones who have back, you can't take the back out. I like the backless. So what does it do? It balances your hips, because a lot of estheticians have tilted pelvis. It's the biggest thing. We have slight scoliosis because we favor the sides. We work either tilted here or tilted here. We have a favorite side that we tilt on. Settle back chair balances your sides. If you're going to swing to one place or to another, it's going to make you feel uncomfortable. You have to sit straight. And when you use settle back chair, you don't even know, but you make a muscle corset that is even, that is balanced. And that's why it's a very healthy idea to work on the settle back chair. Of course, it's adjustable. The prices vary between $119 and $148. I just had a student from India, and she said in India, it's very expensive. But girls, if you can really invest in it, it's worth investment. I know it's very expensive to have if you don't have the table that goes up and down, it's expensive. But if you have a settled back chair, and even if your table that you work on stationary, you can really adjust yourself better. So definitely settle back chair. Any Google search, Amazon, whatever country you are in, see what Amazon like you have. Settle back chair is a very, very helpful thing to fix your posture. Now, all that I would love to see on a WhatsApp. So I need you to make a recording of yourself working, where you have camera on top of the client, and those tripods that hold camera on top of the client called gooseneck tripod. gooseneck tripod. They vary between $14 and $36. And in fact, once we're gonna do the WhatsApp group, I'm going to put you the name and the link, and the links don't work for everybody. I don't think you should go by the link, but I will put you the name and what it looks like. So you're gonna search in your own country for something similar. So the gooseneck, because you can put it right on top of the client's face. And the second camera that I want you to have tripod is the one that shows you. So we could see how you're sitting, how you're positioning your neck, how you're positioning your shoulders. A lot of people work like this. This is terrible for your neck, for your stress level. By the way, like this, you become very anxious, very stressed because there is no blood circulation and you're not breathing correctly. And one more thing that I see very often in in-person classes and online when I'm sending video, people don't breathe correctly while they work. They go like this. Especially when you learn something new, I noticed it very often, and they work to barely breathe. You have to breathe with the client. Your breathing has to be very, very flowy with the client. You do better job that way. Your whole body is more relaxed that way, and you don't tense your wrist that way, and you don't tense your back that way. So watch your breathing starting today. You don't have to do HelenaPahavaMethod facial yet on your clients. Whatever you do on your clients starting today, watch how you sit, watch where you're tensing, and watch how you're breathing. Unfortunately, you're going to be shocked. Some girls are working for 30 years, and it was the first time they saw themselves from outside, what they look like while they work. When I asked them to put a tripod and say, watch yourself from outside, what you look like, what you work like. They write to me, they say, you're right, I wasn't breathing, or no wonder my back was hurting. 30 years she's doing this, and she never bothered to look at her own body while she works. And I'm not surprised, because nobody teaches us to do that. But if you will do it, you will save yourself years of pain and discomfort. Because the most common sicknesses for estheticians are lower back, the neck, the wrists, and unfortunately, certain kind of cancers. But that's because if you use toxic products day after day through your wrists, it goes into your bloodstream and it goes into your body. They say nothing can go through epidermis into the bloodstream. It's not true. If you will take a piece of garlic and rub it into your foot, in an hour from your breath, it's going to come out. Why garlic? Because the smell is strong, right? So if you use toxic products, if you don't check on the products, but we're going to have a Zoom specifically for that. If you don't check ingredients in your product and you rub it 5 times a day through your head, through your palm, of course it's going to go into your bloodstream. That's why definitely watch very carefully what product line do you use, what are the ingredients, Google it. Let's say you use, I'll give you the easiest, Cetaphil moisturizer. That's just a, exaggerated example. Put it in a Google search, Cetaphil moisturizer, toxic ingredients, it's going to give you toxic ingredients there, right? So you know, should you use it or not? So this is very important to protect yourself, protect your structure while you work, make sure you breathe, make sure your shoulders are down so you have a proper blood circulation and proper lymphatic drainage for yourself, and then see what products you use not to intoxicate yourself through your palms. So today, and I will take your questions later. So today we're going to prepare ourselves for a week 1. What is this facial all about and how it works? I will recap very quickly what I said before. So you have all the videos for the facial, they're yours to keep and they will be improved. Number 2, we're going to have 5 Zooms. And I know I have a lot of Australia in here, and I know Australia is not going to make it to the Zoom because it's 2 a.m. right now in Australia. Everybody gonna get recorded version of the Zoom, and it's gonna be yours for 4 months. For 4 months, the Zooms are open. I ask you to listen to the Zooms occasionally, not only once, because only 35% of information presented to you for the first time is observed by our memory. So for something to be really observed and nothing to be missed, 2-3 times it's worth to listen to it. So if you can play Zoom on the background, it would be very helpful because you can observe like a sponge all the information. In this course, you're going to have a lot of new information. So please listen. Zoom is open for you for 4 months, and we have a WhatsApp. And WhatsApp is also open for you for 4 months. Now, there is no rush. Let's say you're busy this week and you couldn't record it this week, the videos, right? It's okay. You can send them to me next week or week afterwards. You have 1 month to send me all videos. The whole WhatsApp is open for 4 months. So you have 4 months really to send me videos. And even if after that you're not going to do it, and you come back to me in 6 months and send it to me in private message because this group is going to be closed, of course I'm going to review it. Of course I'm going to revise it. But don't take such long time because I need you to work on momentum. So basically, this group that we have this month, we're going to develop its own egregore. Egregore is an energetic entity that people develop when they come in 2+3 people. They develop energy of that particular, in our case, Zoom. Right? Religion has egregore, like many like-minded people. They boost each other. There's energetic jolt in there. And our course also has its own little egregore where we feed off each other and we help each other grow. So that's why don't take too long, but if you have to, you have to. There is no pressure as if when you're going to send me videos. There is no pressure when you're going to learn the videos, whenever you have time. I have people who are mothers and they have full-time jobs and they still do this course because there is no pressure and because this course is never gets lost. However, to be promoted, pay attention to that, please. You have 1 year. Within this 1 year from today's day until 2025, February 25th, you have time to get your promotion. What is promotion? Promotion is one reel that I will showcase you to my audience in 2 stories. Now, pay attention. At this moment in time, and later it's going to be even more expensive, to promote on my channel, it costs $2,500 for the reel and $1,000 for each story. So together we have $4,200. You girls are getting this absolutely for free because you're part of this course. I'm talking about when other people come, like a cosmetic companies who want to promote, I ask them for that price. I also ask them for 30 days of use. They have to send me 30 days of the product. Usually it's not good enough. Usually I ask them to send me another 2 months of the product. If within 30 days I didn't see any difference, we go through the process of checking ingredients and I sift them terribly because again, everything that comes on my social media is my responsibility, and I'm not going to take responsibility for mediocre products, right? You guys, I'm sure of, because I know that I will give you everything that I got, and I will watch you working also. I'm not scared to promote you. I will showcase you, but a lot of people don't want to take advantage. Why? Because they're scared to be showcased. One thing I want to tell you, if you're scared to be showcased, you don't have to show your face anywhere. Client's face, your hands, you're good to go. Right? So if you're scared to be visible to the camera because it's not comfortable for everybody, you don't have to show yourself. But your hands, you have to show. People need to see. Hands say so much about esthetician, about LMT, about any manual practitioner. Our hands on a client's face is what tells the story about how we work, who we are, how we connect. The empty hands, you see their work, they do what they're supposed to do, but there is no substance in those hands. They're not about the client. It's visible, it's obvious. And they're hands that are full. Hands that work with intention. Hands that are about the client. Hands that know what they do and why they're doing that. And those are full hands. And it's very visible, believe it or not, through the video. Clients see it. So we have to make sure, like again, the training, that you're so comfortable with this sequence that your hands become full. You already not, you forgot to think about sequence. Now you think only about delivery and about the client and what you're doing right now with this client. It becomes very synergetic. We will talk about it later. It is absolutely magical how good it works on people's faces. So what's up? Sending videos, no pressure when, seriously, do not be pressed. Like, for example, this week's videos is not like absolute necessary to send this week. You can send it next week. You have 4 months of open. Because very important for me is not to put any pressure on you. I don't like to teach under pressure. This is the last thing I want you to enjoy it. I want you to dive into this course, to observe like a sponge information, and for that information to bring result to your life and relax you, make you more comfortable, not more uncomfortable. That's why we're not closing the course. But I also want you to be self-reliant, because I have some people who would take the course and then they keep coming back to me, Helena, how's this, how's that? And it's been already a while. And I'm like, look, by this point, you need to be able to assess your own work. But I understand it has a lot to do with personality. Some people, if you're there, they will come to you, they will ask you, and I will always answer. Always. I will never let person go. But what if something happens to me tomorrow? I don't want you to function against me. I want you to function against your own knowledge. Again, that's why we don't close the course, because you can go, you can revise, you can rewatch, you compare to your own work, you record yourself. That's why I also would love you to. You did the recording of your work, and then you give me your own critique. We're going to compare with my critique. If I agree with you, I will tell you. I agree with you. You're right. If I don't agree with you, I will tell you. If I have something else to add, I will tell you. But I will know that you can assess yourself. So for me, it's very important that after this course, you're self-reliant, you know what you're doing. Of course, you're going to have questions. Some questions will come out of nowhere. Some questions will come from your clients. Come back to me, I will answer, whether the course is on or not, or we have 4 months already passed or not, and stuff like that. But mainly, I need you to know enough to trust yourself, to be able to revise your work and make it better. So that's my goal. My goal is, and that's the part of learning. When you give yourself self-critique, tell me what you could have done better. This is part of the learning. And then we're going to put it together and see if it matches or not. And this is very important part of learning. You learn to be objective of your own work. You learn to be your own observer. Now you observe your work from outside. I have to tell you that one of the best things that really elevated my skill, although I have to say that I did it for a very long time, my skill was always pretty good, is to be my own observer. I could step away from me, and video did this for me. My first tripod really elevated my work and my body position, because I could step away from me and I could watch myself as observer. What did I do wrong? Not from the critical, terrible way to just, we're so self-critical as women, not to criticize myself even more. God forbid, not for that. But for lovingly agree with myself, then this we have to change. We can make it better. Because our profession, if we're not going to consistently strive to make it better, it can become pretty boring. Same facial, the same facial day after day, year after year, decade after decade. It can get boring. But if you know that there is no limitation to excellence, and you watch yourself and you observe yourself and you're self-regulating, then it becomes extremely exciting, extremely interesting. You can share your knowledge with your clients, which we will talk about it definitely, and you can get better results. So far, any questions? Nobody's asking questions. Okay, then we're moving to the week 1, very important. So week 1 of our work, as I told you, you received the whole curriculum all at once, and I really need you to look only in the week 1. Now, before the week 1, you're going to have PDFs, and those PDFs will be very important one. The health questions and how soon after procedures we can do this facial. Botox, threads, fillers, plastic surgery, and so on and so forth. And also the health questions. This facial is pretty much could be done on anybody, 18 to 81, I always say. Why 18? Prevention. Why 81? We restore the healthy functions of the tissue. That's what we do. The whole goal, the whole idea is to restore the healthy function of the tissue. Who cannot have this facial done? Very small layer of community. People with acne, serious acne, cystic acne, hormonal acne, But if you have a client who broke out right in here because she has period in 2 days, it's fine. You can just avoid that area and keep going. But if somebody's covered with acne, you cannot do it. Why? Because massage on acne, you can cross-contaminate the skin. Either topically, it can burst, or internally, it can burst. And with a bloodstream, you're going to take that infection, that bacteria underneath the skin, and the person is even more covered with acne. Cross-contamination. We are not performing this facial on people with acne. Several things. Lymphatic drainage massage. I don't like to do it on pregnant people. Let them collect the amniotic fluid their own selves. People with cancer, when lymph was removed. If person's lymph was removed, please do not perform for her lymphatic drainage. The rest of the facial is very welcome. So as you see, very thin slice of population who could not have this particular massage. This particular facial, it's a facial that based on a facial massage. You have all 4 parts of the facial. So basically, you can take every step in the sequence from the very first move, cleansing, to the very last move, and make it your facial and don't add anything. And you have 60-minute manual facelift work. That includes, pay attention, aesthetic lymphatic drainage, because if you are esthetician, you have to say, if you are LMT, you can say that you just do lymphatic drainage, but if you're esthetician, you have to put word aesthetic. Why? Because we are only allow license, if you're going to go to Department of State Division of Licensing Services, it will tell you that we are allowed to work with chest, neck, and face for the purposes of beautification of your client, right? So when you put word aesthetic lymphatic drainage, we are doing it for purpose of beautification. We are not fixing anybody's lymph system. We are not trained to do it. We are not licensed to do it. We are not going after it. And I will talk about lymphatic with you. Aesthetic buccal massage also. Again, we are not doing it to fix anybody's TMJ. People will come to you and ask you, oh, I have such terrible TMJ. Of course, it's going to help them, but we cannot out loud say that, yes, I can help you. We're doing it to leave the face, to take the stagnation, to settle ligament, relax, and leave the face. And you will see how well it works. It works right away. And of course, it releases them of the pain, but we cannot announce it as estheticians. So everything we do is for beautification. But what do we use to beautify the faces? We restore a healthy function of the tissues. This is how we leave the face, by restoring healthy function of the tissue. What the restoration of healthy function of the tissue does, it relaxes the tissue. Clearly, it relieves temporarily symptoms of TMJ, but not consistently, because for consistent relief, they need to wear a mouth guard. See, because you just relax them, it feels really fantastic for 3-4 hours, and then she goes to sleep and she does this again, and she brought everything back to normal. That's why we give them also facial exercises, because we help to maintain what we did. Otherwise, she's going to get a facial. In 2 weeks, she's going to be back exactly where she was. That's why facial exercises are so extremely important, but we're going to talk about them in the next Zoom. This Zoom, I don't want to clutter your mind too much. So we're doing it for aesthetic purposes. We start this massage with aesthetic lymphatic drainage. What do we need it for? See, people collect, especially if people have bad posture, they collect a lot of fluid in their faces. And I'm going to give you now the example. If you take 2 cars, Lamborghini, let's say, I'm just giving you exaggeration, and Honda Civic, and we put them next to each other, and it's snowing outside, and they both are covered with snow. On the layer of snow, Lamborghini and Honda Civic gonna look exactly the same way. You have to clean the snow out to see what's underneath. The same thing happens with people who hold a lot of fluid in the neck, in the chest, and the faces. Fluid covers their beautiful features. And on the layer of snow, on the layer of water, on the layer of puffiness, it's very hard to see what the gorgeous features your client has underneath. So the number one thing what we need to do, it's a preparatory step. We're preparing the tissues right now. Is we need to re-herb of that fluid. How do we do it? We do it with two ways. We do breathing lymphatic. You will see it in your videos. And then we pumping lymphatic nodules. Lymphatic nodules need to be pumped with a very light hand. It's a very bouncy move. We do not remove our fingers from the client tissues, never. We just give bounce and up, maintaining consistent connection to the client, always. Now, why do we need to do it? Because right here, give me 1 second. Right here. Do you guys see?
Mhm.
Do you see the face of the ladies, on your screen? Okay.
Yeah.
Do you see how swollen she is?
Yes.
Okay, so it's exaggeration. She has an edema, right? Strong conditions is exaggerated. But a lot of people hold the fluid in their face, in their nose, nasal, if you see, orbicularis, oris, orbicularis, oculi, eyes, mouth, jowls, right? Next to mentalis, they hold the fluid. If you're not going to get rid of this fluid on her face first, you're not going to be able to work properly with her soft tissues. You're not going to be able properly to drain her face, to lift her face, because the water makes it heavy and it drags it to the bottom. And that's why we start with lymphatic drainage. Again, aesthetic lymphatic drainage. Now, remember one thing, and this is extremely important thing. When the client is going to come to you, and let's say she holds fluid all over her face and underneath her eyes, because we have a socket in here, and she's going to be lying down horizontally. After the facial, not only you're not going to see great results underneath her eyes, in some cases it's going to look over exaggerated because she was in horizontal position and there is a socket in here, it collects in here. She needs to go vertically for an hour, sometimes two, to drain the fluid from underneath her eyes. So it's very important for you to tell this to the client before she got on your table, before she got under your hand. Because if you're going to tell her after the facial, she will think that you just made up the story so she could feel better. If you will tell her before you start the facial, and this is separate conversation for next Zoom, but I want you to remember it. I want to say it a couple of times so it would be engraved in your mind. That we're going to give you a facial and you're going to feel amazing and you're going to look amazing. However, underneath your eyes, you might not see the difference, or you might even collect a little more fluid than you have right now. So your eyes are going to look better, but in an hour or two after the facial. What I need you to do today, I need you to drink a lot of water. I need you to walk as much as possible. I need you to stay away from sodium, pickles, salty food, fried food. And I need you to stay away from alcohol, just for today. So you could drain the face and see what your face is going to look like once that fluid left your face. People who have a lot of fluid in their faces also, facial exercises and stretches are extremely important for them because they're like this. So imagine there is the pipe and then the water has to go through the pipe. That pipe is like this. Here we are, the water is stuck. It cannot go down. There is prevention. We need to open the pipe for them to drain the fluid. How are we doing it? With the facial exercises that I'm going to send you next week. We're going to go through them and I'll explain to you why are we doing what we're doing. So you will have to communicate to your client and explain to her that her eyes are going to look better in an hour or two, and she needs to work with you and collaborate with you and do the facial exercises. Gross, it takes between 12 and 15 minutes a day. She's going to look so much better. And you have to tell her that. So if she will work with you together, it's like a joint project that you have, collaboration, alliance. She's going to have a long-term, beautiful results that's only going to get better and better this time. Because imagine she came to you and you gave her beautiful facial. Imagine she doesn't have problems with underneath the eyes, so she stood up and she looks gorgeous, right? She went home. She had a fight with her husband. Her kids were misbehaving. She had a couple of glasses of wine. She ate some pickles on top of it. She was stressed all night. She was sleeping like this. Is your facial going to last? No. That's why sending clients back home without any backup in a musculatory structure, it's not a waste, really. She enjoyed the facial and facial feels good. It's fantastic for her nervous system, parasympathetic nervous system. It's getting relaxed. It's perfect, but it's not going to last. For her facial to last, she has to collaborate with you and do at home what you tell her to do. And that we're gonna cover next week. Why is it so good for her? Because it's a long-lasting results. And people will ask you how long results will last. You will have to tell them that results will last. The longevity of result depends on their own internal resources. If you're gonna go to the textbook, it will tell you, I'm translating from Russian, but still, it will tell you that longevity of result depends on your client's internal resources. What is internal resources? Where she is hormonally, how is your immune system working? Is it receiving all the goodness that you do to her? And where at this point of time is her stress level? And if she is stressing, her internal resources are going down. It's not going to last very long, no matter what a great job you did. So when you communicate to your client that she needs to do this particular exercise, again, I'm going to send them to you, definitely in WhatsApp. Next week, we're going to address just that. This is just orientation. I need you to understand, what is this facial made of? It's certainly not made of only from the 1 hour practice they do with her during you touching her. It has so much more to it. This is how we get the best results. So if she's going to do it, and you're going to give her, now we are not dietitians, we cannot give them dietary advice, but we can give them friendly advice and explain that, they have to drink a lot of water. They cannot go completely oil-free or the skin is going to get very dry very quickly, that they have to manage the stress. By the way, exercises that you're going to send her are going to help her to manage the stress. So we don't just tell them do it and don't tell them how. We tell them do it and this is how. We support what we suggest. It's very important, right? And if she's going to do all that, she's going to have great results. Whether she comes to you once a week or once in 3 months. Now, why is it good for you to put so much effort into the client? A, because you make a difference in person's life. B, because she will come back to you. See, right now on Instagram, there are hundreds of thousands of estheticians showcasing their works in hopes to bring new clients. And very often, those new clients are your clients. There are also hundreds of thousands of women looking for something that's going to bring them results because they've been disappointed already several times. They're willing to try something new. What you need to do, you need to bring these people back to you over and over and over again. And what brings people back to you over and over and over again? Result that you deliver that nobody else does. And that result is not only the facial, it's what you do before the facial, what you do after facial, what you do in between the facials. See, in between the facials, you still should be there. Your exercises should be there. She should work on the goal that you have together. So when she comes to you next time, she will showcase you the difference that she made on herself. It becomes her little project. That brings people to you over and over and over again. I have people for 25, 30 years, over and over and over and over again. Why? Because we work on combined results and we both work for her. And she knows that. And this is why we do concentration zone, because I will tell you how to make your client feel and do it truly that she is the main focal point of your attention when she is with you. So the whole experience has to be quite extraordinary for her, over and over and over again, for you to have this client for years and years and years and bring even more clients. Very often I have clients coming to me telling me, I've been to this famous esthetician, that famous esthetician, and I've seen their work on on Instagram, and it's excellent work. And I'm like, why are you here? Why did you travel to me from so far away from here? Over and over, I hear that. I went for the first time and it was beautiful. Second time was still good. By third time, it was not the same. People want consistency. The excellent has to repeat itself over and over and over again. But once it becomes habit, it's very easy to do. So you learn it, you make it part of your identity, and then it's not hard for you to do it. So even if you've seen your client for 20 years, you still gonna take her as a client that you've seen for the first time. Why? Because she matters. You cannot bring your bar down just because she's been your client for a long time. And I noticed that the biggest mistake my fellow estheticians do, they try this a client for the first time, second, third time is already. So that we have to eliminate completely. Now she has you on her phone, she does exercises that you send to her. Constant reminder of your existence, of the goal that you have together. Then she comes to you, she already looks better because she did your exercises. You do her facial, now she looks even better. She goes home and she practices. Do you understand how this machine works? Now, sometimes people fall off the wagon. People get sick, unfortunately, people get divorced, their parents get sick, so many things can happen in life. Sometimes people fall off the wagon. So you don't see them for 3 or 4 months. And then they come back to you because they know that you can fix it. So even if they don't come back to you all the time and they fell off the wagon of self-care, when it hits their mind again, I have to take care of myself, you're the first thing in their mind. Why? Because they already know and they have a living proof. Proof is in a pudding that you helped once, you're going to help again. And you start the process again with her. And this is how you maintain your client base. Once you maintain the client base and you have people competing for you, now you become in charge of your prices, days, how many days you want to work a week, how many clients you want to take a day. But that math we're going to do later. We're going to definitely approach it and we're going to talk about prices, everything. How many times a week she should come, how much you should charge, it's all going to be addressed. But right now, I just want you to take the essence of this facial. Because from Instagram, people don't understand the depth in which we are working in this particular method. Somebody wrote to me the other day, she said she took another course and the moves were the same. So this is not your method. It's just, everybody does that. Method is not in what we do because nobody goes against the Langer's lines. And I'm not going to drain lymphatic drainage starting bottom down. Of course, I'm going to start lymphatic drainage down, up, because this is a correct and proper way of doing it. I'm never going to drop tissues down. Of course, I'm going to go upward. This is not the method. Learning how to do it correctly is part of the method. Method is different. Method is to deliver the results from facial in the house while you're doing it and outside over and over and over again. And actually change how she views herself, change how she feels about herself because her posture is going to be corrected. And change your own schedule and how you see yourself. Because once you deliver result over and over and over again, you see yourself differently. You've been esthetician, and now you're master esthetician. And I actually think of us as artists, to be honest with you, because if you're doing it well, you can do so much, you can make art. And for me, it's very exciting, but see it how you want to see it. So the start preparatory stage is removal of lymphatic fluid, light hands. Why do we need to do it? We just saw the lady with edema. And when you have so much water into your face, you don't see the beautiful features and you cannot really work with the soft tissues, right? So, and explain to her the eyes. Most of the time it's eyes that look just a little more, rarely a little more swollen. Sometimes there is no difference right after the facial, but as soon as she goes vertically and starts to walk in a couple of hours, it's beautiful. Can we remove the subcutaneous fat migration in here? No, we can't. But the fat everywhere in the body, including underneath the eyes, has tendency to trap the fluid. So if somebody comes with a really big bags underneath the eyes, and you clearly see it's not fluid, it's fat. It's already subcutaneous fat migration. She already has facial osteoporosis. This is how her genetic ancestry works. They all get bags underneath the eyes. You cannot remove, but you can make it look better. Yeah, you can. Not dramatically, but always a little better. Because although you cannot move the fat, I mean, if you do a wrong job, you can move the fat, and we'll talk about it. We do not want to move the fat. We can remove the fluid. We go in here. We have lymphatic nodules in here and lymphatic nodules in here, and we're gonna pump it out. So fat will stay, but fluid is gonna go. Her backs are going to look small. So this is what we can do. So we start with a lymphatic aesthetic. This is a biggie. Aesthetic lymphatic drainage of the face. We start with the body breathing because we need to move the fluid into intercellular fluid. So then through the kidneys, she's going to reduce it. We need to remove fluid on her neck. It's extremely important, and underneath her jawline. Lymphatic drainage of the face itself is going to go to the next week's curriculum. We are not talking about that. In this week's curriculum, we do not touch face at all. We don't even little bit work with face. Why? Because we need to prepare all the tissues surrounding the face for the lift. So by the time you're going to work with the face, all the tissues surrounding the face are going to be prepared to receive the lift. See, if you're going to work up to here only and work only with the face, she's going to get up. In 2 hours, she's droopy again. Because here, everything is stagnant. What you need to do, you need to work with that area. I'm going to go to the screen again. And open the screen for you. Give me 1 second, ladies. I've been doing it for so long, and I'm still not fantastic with it at all. Do you see? Do you guys see the layers of the face?
No.
Give me 1 second. Terribly sorry about it again. I was wondering if you see it now. Do you guys see the layers of the face?
Yes.
Okay. So let's go into the layers of the face, and let's start actually from the bottom, right? We have a deep fascia. Underneath we have bone. Remember that. You're looking at it, right? Everybody looks at that picture right now. Is that correct?
Yes.
Okay. So we have a bone, and it's not shown in this particular picture. And then we have a deep fascia, right? Then we have a ligaments and space. Then we have a muscular aponeurosis, subcutaneous, and skin. Clearly visible, right?
Yes.
Great. What I really need you to pay attention to is the one that says ligaments and space. It's number 4. This is something that most people are missing. So what happens in there? You saw the ligaments and space. Between layers, soft layers of our face, because face is made from many layers, right? We already saw it. We have a deep fascia. We have a muscle, we have medial fascia, superficial fascia. So that map actually was not exact, but it was more or less what we need. We have a subcutaneous fat, we have a skin. Between the ligaments and all the other layers, we have space. And what happens with age? The space becomes clumped, and it starts to drop because everything is connected, the clumping, and it starts to drop everything down. One of the biggest things we need to do in the part 1, the part of the facial we're learning right now, is work on epicranial aponeurosis. We're gonna work on the ligaments and contractions around the ear. Why we are doing it? We're recreating the space that once was. Young people have so much space between the tissues. As we get older, the tissues become clumped. And in many places, like epicranial aponeurosis, for example, they develop fibrosis. What is fibrosis? Fibrosis is overproduction of collagen. and other intracellular matrix that makes glue-like material that puts the layers of soft tissues together. It locks them. Once those layers are clamped and locked, there is no blood circulation. When you have no blood circulation, the cells around starts to die down, and we're developing something called ptosis. Ptosis is simply muscle that cannot hold itself. There is no oxygen supply. There is that space between the layers. There is no blood supply. It droops down. So all those fallen faces that you see on older people are ptosis. Why ptosis happen? Ptosis happen for many different reasons, actually. So as everything in our body, in our face, is never only one reason. It's many of them. So do you guys see the skeleton right now, the picture of the skeleton?
Yes.
Okay.
Mhm.
So you see the young part, and then you have the old part on the side, right? This is approximately by how much we are going to lose bone towards our mature age. And when you have bone receding to that capacity, look how much smaller it is. All the muscles start to droop on it. So your muscles are like oversized sheets on a small mattress. The bone is there to hold our soft tissues. But once it shrinks, it cannot hold it anymore. Muscles, unfortunately, don't shrink with the bone. They in fact stretch because of the gravity, right? And the face starts to fall down. So far, does everything make sense to you?
Yes.
Okay. So what do we do now? We cannot say, okay, so bone shrinks, muscle falls, or like, no. There is a ways to take care of it. That's why I say this massage is so good for younger people also because it works as preventative. You will see that during the first week, now we're talking first week only, we're working with a lot with epicranial aponeurosis. So we work with all this area. We pay really good attention to our occipital muscle because occipital muscle, ladies, is continuation of the face. That's why we really always work with occipital. We go up the occipital. Why we pay so much attention during facial at epicranial aponeurosis? Because this is not something that people do very often for two reasons. A, we need to create a space between tissues to get blood circulation, to recharge those tissues. Two, we need to create piezoelectricity. Piezo is from the Greek word pressure. When you put pressure on a human bone, the bone releases naturally piezoelectricity. When you're young, your piezoelectricity works really well. It's really charged high. As you grow older, especially during the age of menopause, when you have this hormonal decline, piezoelectricity goes down. That's when we get osteoporosis. But because we work with faces, let's talk about face. This is when we get facial osteoporosis. So how do we prevent that, right? For our clients and for ourselves. Every time you give yourself pressure on the bone, and you do massage and you move the tissues. Now, ladies, massage not like this. We don't washing hair. We're going into the epicranial. We press the fingers down and we move the whole layers of soft tissues on top of the bone. 1-2 minutes a day. Do it on yourselves also because it will preserve your bone too. Once you apply that kind of strength into the bone, you create piezoelectricity from outside source, from your own hands. Now, when you apply piezoelectricity, when you encourage production of piezoelectricity, that encouragement of electricity produces cells called fibroblasts. Those fibroblast cells are cells that are rebuilding the bone. Now, aestheticians out here, we know a lot about fibroblasts. We know in the dermal layer of the skin, right? Fibroblasts are the cells that produce collagen and elastin fibers. Collagen and elastin fibers. I'm talking skin right now, just to connect your knowledge to what we're doing right now. Collagen and elastin fibers give us tensile strength. It makes our skin bouncy. They give us pillars. In between collagen in a dermal layer and elastin fibers, you have what? Intracellular matrix and extracellular matrix. What is it made of? Hyaluronic acid and glycoproteins. And that's what gives us cushion and puffiness, correct? This is what fibroblasts do in a dermal layer of the skin. But now we're talking bone. Pretty much the same structure. The stimulation of production of fibroblasts is going to give you bone building cells. And instead of shrinking over age, over time, you preserve the width of your bone. How do we do it? Two ways. We massage the bone, we put the hands in and massage the bone. And the second way, actually, ladies, is to work with weights and resistant bend. Every time your body, because face is not disconnected from the body, right? We are one organism. Every time, young or old, I don't care how old you are. Every time you work with weights, not the overwhelming weights that's going to hurt you, but just a little something that you have to use resistance, you work with the weights in your body. Every time you apply pressure to your epicranial aponeurosis, what do you have? You produce externally piezoelectricity. Piezoelectricity produces fibroblast cells. Fibroblast cells produces cells that rebuild the bone. So the bone will always be thinning. It's natural process. Skin has desquamation. Remember, the epidermis has 30 cell layers of cells, and by the time it comes to the surface, it's going to go through natural desquamation process. It's going to fall off. Exactly same thing happens to the bone. So the bone is going to get thinner, thinner, thinner. It's going to fall off. What do you need? You need fibroblast cells. Now, in skin, it happens in dermal layer, right? In the basal layer. In the basal layer, we produce the fibroblast that produce collagen elastin fibers, right? Same thing happens with the bone. Why I give you the example of the skin? Because as a esthetician, it's easier for you to understand. You can put together, so this is skin, of course. Okay, so bone works the same way. Not exactly the same way, but it's the same. The cycle, the cell turnover is the same. Unfortunately, just as with skin, with bone, yes, the desquamation is going to happen, but the rebuilding cells, they become less and less as we grow older. And the only way, I mean, there are a couple of ways. There's also vitamin K. They say other vitamins, but we are not nutritionists. The only way you mechanically can do it, knowing to us, it's scientifically proven, is piezoelectricity. That's going to produce the bone rebuilding cells. And that's why we are going in there and we massage the epicranial aponeurosis. We need to produce the fibroblast cells that then they're going to rebuild the bone. Tell to your clients, all the time, young or old, they have to massage the epicranial aponeurosis on a daily basis, at least 2 minutes. It prevents the shrinkage of the bone. Most important component of the beauty is not skin, it's bone. Bone holds the whole face, right? So once bone is shrinking, everything is falling. Very difficult to put together the face when everything has fallen. That's why we need to prevent the shrinkage of the bone. So what do we do week 1 in this course? We're reducing the fluid to see the features. And we work on the bone and unstagnation of the contraction of the soft tissues. So far, do I make any, do you follow the logic in here?
Yes. Yes.
Any questions?
No.
That's,
So,
that's
then-
helpful.
Mary, talk to me.
Oh, I was just saying that's very helpful.
I'm
The-
glad to hear that. So it's very logical. What we are doing is extremely logical. Working with the face right away gonna get you nowhere. Because face you have to attach to something, something has to hold it. And if this is all stagnant, it will not hold the lift. What else holds the lift? Posture holds the lift. The elongation of the neck. Do you know that by the time you're 35, you're probably missing 1/4 inch of neck? We go like this. Once you open this, everything opens. We have to take construct of the human body is very important. How I came to it, as I told you, I was born into the beauty salon, but my family didn't do it. I was lucky enough to be sent to ballet academy to train. And it was my training in ballet academy where I understood how important the posture. Now it's more like people talk about it, but in my time, nobody talked about it. People came for facial. We would put the bed around the hair and work directly on the face and on the skin. That's what we did. 80s, 90s, who worked in the 80s, 90s. You know, I'm telling the truth. Now people became wiser. What made me wiser? My own aging. What made me wiser is my own aging. I saw facial osteoporosis on my parents. I'm genetically not blessed. My ancestral aging, horrible. And I realized I started to do it on myself, and I saw that I look better and younger over time. And I started to give those exercises to my clients because I knew that if I'm not going to help them internally, because you know what, in mother's womb, heart forms first. We are forming from inside out. Guess what? We are aging from inside out too. So before you see the aging on your face, now skin has two aging. Ages from inside and also sun rays, right? UV rays really ages us. So skin is different. But the dragging of the muscles, the bone started to shrink. We age inside out, bone to skin. And we have to, although when client comes to us, we don't see the bone, you can detect facial osteoporosis right away. She's all falling down. There are different types of aging. Some people have that, some people have type this. Some people, Audrey Hepburn, think about Audrey Hepburn, picture in your mind, everybody knows her. Intact musculatory and the skeleton, skin was crinkly. That's the easiest. If Audrey Hepburn lived today, we would fix her skin like this. She would look 40 in her 70s. It's the easiest way to fix. What's the most difficult thing to fix? Aging of the bone, facial osteoporosis, especially when they come to you and they're already full. It's tough. But you know what? We can still make a difference. We can still make a difference. Clearly, we cannot do what plastic surgery does if she already has fallen everything. But plastic surgery also is not a magic wand. And very often I've seen people going for plastic surgery, having the lift and everything completely tight old lady doll, not younger, just tighter. This is where we come into the picture because we can work with people who want to be natural, or we can work with people who do plastic surgery, Botox, fillers, everything, because we can make them look better after they went for all those procedures. Less frozen, you know, like they cannot do any of that. And they don't want to do any of that, but they don't want to be like this either, right? We can make them look less frozen. We can make the face more relaxed. And you know what the biggest indicator of age on the human face is? The mask of grimace, the mask of stress, like this. All the people get shrunk, some collect fluid, and some collapse inward and down. They get shrunk. We will talk about how face collapses, especially when we're gonna go into intraoral buccal massage. I'll explain you how this method is very different because we are not there to work on a masseter. We can work on masseter from outside. We are going there to create the space. Remember I talked to you about creating the space? Space is everything. Young people have space between the tissues. And that's why they have oxygen supply. And that's why they have a good blood circulation. And they rebuild the fibroblast faster. And fibroblasts give the cells that are reconstructed. What happens with age? Everything collapses. The natural, normal, healthy functions are not working the way they used to. And that's where we come into the picture, externally applying our energy, our knowledge, our work to restore the healthy function of the tissue. And then when we give them also exercises to do at home, now you understand what's going to happen? And yes, maybe if she has very thin lips, we're not going to give her pout that should, you know, the filler is going to do. And if she has already huge bags under eyes, we're not going to be able to remove it. We can't. But you know what we can? We're still going to make her look younger. We still will, because of the blood circulation and because of the space that we create between the tissues and in the oral cavity. Once you recreate this, because nobody pays attention to the space. It's what's between we're working on by using what we have underneath our fingers clearly. But if you concentrate on the right thing, you're going to get different results. And this is what we are achieving in this course. So far, any questions?
No.
So, week one, aesthetic lymphatic drainage, bouncy light hands. You have videos for it. Working on around the ear, all the ligaments that were stuck. Occipital, a huge point of paying attention. and working on epicranial aponeurosis. Now, working on epicranial aponeurosis is not easy on your own hands. I give you two options in there. I give you option working with your hands and option working through the towel. Please try both. Some people find the towels very, very helpful. How I came up with a towel, my grandmother had osteoporosis in her hands. She was still working, but she couldn't move very much of the tissues. So she worked through the towels. And you know what? It worked for her hands. So why wait until we have osteoporosis? Try to work through the towel, see if you can put less stress on your ligaments. But the thing is, this is where your clients have to help you. And you have to tell them to do it every day for 2 minutes on their own hand. By the time she will come to you next time, she's going to be much more mobile on her epicranial. Otherwise, it's very hard for your tissues on your hands. Now, except for this, in this method, nothing is going to be hard on your hands. There's only one move when we really move them. That's a little hard on the hands. So find yourself a way that is the easiest for you. Some people like to sit, some people like to stand. I like to stand because I use my body, also the weight of my body to help the movement. But some people say they're uncomfortable that way. So gauge what's comfortable for you. But the best thing to do is to engage your client into it and give her homework 2 minutes a day to move, show her how you put your hand in and you're really moving the tissues. You're not washing the hair. You're moving the tissue. This is a biggie, huge thing. 2 minutes a day. Next time she's going to come to you, she's going to have much more mobile epicranial. You will not have to work so hard on it, right? You will have other things to concentrate on. And it's very important for me to really be very preservant with your hands. So let's keep your hands as safe as possible. So yeah, if you can get yourself settled back chair, I'll send you pictures of everything in the WhatsApp. Number one thing that I need from you right now is to write to me on Instagram and say, this is my name. I'm in February 24th course, and this is my phone number. And then I will send you all the links to the group. You're all going to receive recording of this Zoom, whether you attend it or not, because I need you to listen to it. You hear there's a lot of it. It's a different approach. It's a very different approach. So I don't expect you to, from the first encounter with information, to remember everything. That's why I need you to listen over and over again, right? I need you to listen to the Zoom. Remember, it's open for 4 months. Course is yours forever. The WhatsApp is open also for 4 months, but even after 4 months, I will review your videos. Send me videos, please, if you can. Do not be bashful. I will send you example of the videos in our WhatsApp chat. So I'm probably going to start sending you information tomorrow because it takes a couple of days for everybody to come into the chat. And what happens, the person that comes last into the chat doesn't see what happened before, and then we repeat information and girls get bored. So let's give it about 24 to like maybe 36, 38 hours, and I'm going to start sending you all the links. If you're going to do recordings, nobody ever does, but if you will be the first person who will do recordings like today, send to me in the WhatsApp chat and I will see. I encourage everybody to join the chat, but if you are specifically particularly bashful and you feel that for you it's going to be terrible pressure to go in the chat, I will talk to you outside from the chat. But you're robbing yourself opportunity of showcasing your work and work as a group. It's just a healthier way to learn for you, just warning you. And that's pretty much it for today. Did you guys feel like you grasped something, learned something?
Yes,
Yes.
it's wonderful. Thank you.
Pleasure. Please, as I told you, listen, it's going to be sent to you by tonight. You're going to have recorded of this particular Zoom. Listen to it. Things will come up. Things that you didn't hear me, even though you were in a Zoom, but it kind of didn't register. All of a sudden will make sense. And go through the curriculum only of first week. Do not run ahead, please. It's important. Because when you're going to look at the first week, it's going to look so easy. You'll be like, oh my God, I can do it with my eyes closed in my sleep. It's not. Connected to the client, lymphatic drainage, very, very delicate, very intricate work. You have to be very bouncy. And you know what happens after a while, once you become really good at it, you feel like you move the water. You become like a water bender. You feel like a water bender. You definitely can move water and you feel it underneath your fingers. It's very exciting. One of the biggest things, do common mistakes. People, when they drain into the armpit, they unattach the hand stays. One part of your hand still has to be attached and you're pushing forward. But then I will fix you. Once you're going to send me videos, that's bad. I will fix you. And if you can write a little critique underneath for your own self, it will be great for you. It's a very healthy way to be able to catch yourself in a mistake. Start recording yourself. Watch yourself from outside. You will see so much about yourself. What state of mind you have when you work, how stressed you are you breathing, not breathing? That gives you the whole, data about what you put yourself through when you're working, and then you can start clearing it. And I will see it too. If you will send me videos where you work in your body position, I will tell you where you go wrong. Right? And there is nothing wrong with it, please don't, because most people are not taught. I have people who went to 1, 2, 3 schools in Eastern Europe and then in America. And I was like, who put your body while you work? And she's like, no one. So most people don't watch after your own body, they watch what you do on a client. So don't be bashful if something is not right. We'll fix it, we'll correct it. You will carry this knowledge for the rest of your life. You can preserve yourself. It's very.
Thank you so much.
Thank you so much for being here with me. I'm looking forward to you next week, and please reach out this week. Send me your phone numbers and we will get in touch on the WhatsApp.
Thank you.
Thank you, ladies.
Thank you. Take care. Bye bye.